So in this review of the first quiz one in this class and in the series, we really want to go over these questions and really look at what are the reasons why we're answering the way we are and getting these questions correct or practicing for essentially the real thing, the real registry. So question one, what type of magnet is used with most MR systems? Superconducting. Yes, it's the most expensive, but it's also the most strongest magnetic field that we're really able to consistently operate with. Yes, there are liquid cryogens. They keep the magnet winding super cooled, and we'll talk about that in a moment. But the superconducting system is the most commonly used with MR systems. Visitors, question two, visitors and site employees entering the MR scan room with the patient should be carefully screened for metal in the same manner as the patient. There is no avoidance, if you will, of getting away from that, because really what we're looking at is the aspect of we have to follow along with what the aspects of exposure to a magnetic field are. So whether or not it's a parent, a visitor, a friend, a family member that's inside the room with the patient, they have to be screened as if they were being scanned themselves, changed, into whether it's a gown or scrubs or whatever's provided to patients that are undergoing MR procedures. FDA limits SAR, specific absorption rate absorption, for whole body MRI applications to 4 watts per kilogram for 15 minutes per sequence. So 4 watts per kilogram, watts per kilogram, think of power per pound, for 15 minutes per imaging pulse sequence. This is not the totality of the exam scan time. Patients with suspected intraocular metallic foreign bodies must be screened for metal prior to entering the static magnetic field. This can be done by taking plain film x-rays of the orbits and obtaining radiologist clearance. Patients with, and plain film x-rays is at a minimum possible, and if allowable and we can, CT would be preferred due to the resolution and the detail that provides. But according to these questions and available answers, question 4 is D, taking x-rays and obtaining clearance that's documented by the radiologist. Question 5, patients with tattooed eyeliner or other ferrous pigment eye makeup should be advised of what possible complication during the MR procedure, temporary skin irritation or swelling of the eyes and or surrounding tissues, cold compress, treats, potential burns or irritation. So 5 is C. Question 6, which of the following's primary biological effect is the missile or torpedo effect and associated tissue tearing? That is the static magnetic fields. Static being immovable, and the strength of these magnetic fields, 1.5 Tesla, 3 Tesla, can be very powerful. Again, that force is going to be based on the size of the object, the ferrous nature of the material, or the ferrous properties, and then, of course, the strength of the magnetic field. Question 7, all the following are ferrous substances except for gold. Question 8, which of the following is not a magnetic field utilized in association with MR imaging, gravitational Earth magnetic fields? 8 is C. 9, which of the following has been documented to cause muscle contractions, cardiac arrhythmias, mild cutaneous sensations, and visual light flashes? That would be exposure to our gradient fields, or TVMF, or time-varying magnetic fields. Question 10, which of the following's primary biological effect is tissue heating or deposition, thermal induction, warmth to the patient? That would be our oscillating short burst of energy magnetic fields, known as our radio frequency field. Question 11, the FDA recommends posting warning signs to indicate the 5-Gauss line. Question 12, all of the following are potential biological effects of the TVMF, except for the missile or torpedo effect. That would be due to our static magnetic field. A, B, and D are effects or risks of the time-varying magnetic fields. Question 13, FDA safety levels for RF exposure during MR examinations are defined by SAR restrictions, which are imposed to reduce the risk of systemic and or thermal injury. Enter the patient's weight correctly at the time of registration, and also ensure that you are placing padding as you position the patients in the magnet to create a separation between the edges of the bore itself. Really important, as those radio frequency coils are positioned closest to your patient, that we are putting that padding in for safety purposes to create a separation from the patient and the magnet edges. Really crucially important. Question 14. FDA guidelines dictate a level of concern when RF energy absorption produces an increase in body temperature of 1 degree Celsius. Question 15. Risk factors of an MR exposure with regards to SAR include all the following except for hypotension. Low blood pressure is not a heat risk. Hypotension is the answer to 15B. 16. What element in the body is the principal nucleus utilized in MR imaging? That would be hydrogen. Question 17. From closest to furthest from the patient, place the MRI coils in order. This would be radio frequency, gradient, shim, and main magnet. So 17 is B. 18, B1 is another name for radio frequency field, always going to be perpendicular to the main static magnetic field. B1 is basically looking at the XY gradient axis plane. 19, in a cross-sectional view of the MR machine instrumentation, which coils are closest to the patient? That would be our radio frequency coils. Question 20, the liquid cryogens are cooled in a superconducting magnet at a temperature of 4 Kelvin. 4 Kelvin, very cold temperatures. Question 21, resistive magnets can be shut off quickest in the case of emergency. They're the only magnets that can be shut off at the end of the day, overnight, on a long weekend. Question 22, during a quench of the MR system, patients and employees should be evacuated from the scan room to avoid asphyxiation, frostbite, or potential damage to tympanic membrane. Quench is that combustible release of our gases, our spontaneous loss of our magnetic field. And it should be obvious, but this can only occur in a superconducting MR system. 23, the force that an object can be attracted to the magnetic field is reliant upon the specific ferrous nature or properties of the material, the mass of the projectile, and the field strength of the MR system. The answer to 23 is essentially 1, 2, and 3, so your answer is D. 24, how many different magnetic fields are associated with magnetic resonance imaging? That would be 3. Our main static magnetic field aligns the protons. Our radio frequency field creates energy, and our gradient or imaging field will essentially encode the data. So 24 is C. 25, the FDA has limited field strength of clinical use to 4 Tesla for the entire population and 8 Tesla for those that are over 1 month old. 25 is D. 26, ferromagnetic substances have strong magnetic properties and can be pulled into the magnetic field. They also retain their magnetism upon removal from the external magnetic field. 27, magnetophosphines are a potential side effect of the TVMF or gradient field, described as seeing stars or visual light flashes. 27 is B. 28, first level controlled mode, in which operating parameters, dB over dt, which describes our gradient field that dissipates with distance, or SAR, reach values that may cause physiological stress. There are 1 degree Celsius temperature rise or up to 4 watts per kilogram. First level controlled mode is hotter to your patient, but faster in overall scan time. 28 is B. 29, what is the definition of SAR? That is specific absorption rate. 29 is B. 30, what field strength is the system operating at utilizing a 30,000 Gauss magnetic field? 3 Tesla. 10,000 Gauss per Tesla. Unit of measurement in detecting field strength at isocenter is known as Tesla. Orientation of the main magnetic field in a low field permanent magnet, open MRI, is vertical. 32 is A. 33, comprised of unpaired electrons. Paramagnetic substances, C, are positively susceptible and become magnetized when placed in an external field, losing their magnetism once removed from that magnetic field. 33 is C. 34, comprised of paired electrons. Diamagnetic substances do not have any properties of magnetism, save for a slight negative or repelling force. 34 is D. 35, passive shielding can be defined as steel lining in the walls of the scanner room. 36, active shielding can be defined as Superconducting windings within the scanner bore, reducing the footprint of the fringe field. Copper lining is actually describing the RF shielding or radio frequency shielding. Copper lining is the Faraday cage maintaining the integrity of that Faraday cage. 37 current FDA regulations limit patient exposure of the time-varying magnetic field, D, at levels at which the patient feels unbearable peripheral nerve stimulation. There is no set number or PNS percentage or threshold that we are not to cross. It is up to levels at which the patient can tolerate. So 37 is D. 38, the array processor is located in the MR equipment room, is used to mathematically reconstruct the signal data into the image. 38 is D. 39, the patient image display with the parameter adjustment function controls is located in the scan control room. 39 is A. 40, the unit of measurement of the magnetic field surrounding the periphery of the MR scanner is known as Gauss. Remember that Gauss dissipates or decreases in intensity with distance from the magnet's edge. That concludes quiz 1. I hope that you found this to be helpful.